If you're over 60, there's a good chance your body is quietly running low on nutrients that keep your bones from breaking, your brain from fogging, and your heart from struggling. And most doctors won't mention it unless you specifically ask. I've talked to hundreds of people who thought their afternoon exhaustion, their achy joints, or their senior moments were just an unavoidable part of getting older, only to find out later it was a simple, fixable nutrient gap. Today I'm breaking down the 9 vitamins seniors should never ignore after 60, what they actually do inside your body, exactly how much you need, the warning signs that you might be running low, and where to get them safely, without wasting money on supplements you don't need. Stick around until the end, because I'm also going to tell you the one thing almost every vitamin video gets wrong. The advice that could actually save you money and protect your health at the same time. Let's get into it. I'm a doctor, but I'm not your doctor. But I want to be really clear. This is educational content, not medical advice. Every body is different, every medication list is different, and the only person who can tell you what you specifically need is your own doctor or a registered dietitian. That's especially true if you're on blood thinners, blood pressure medication, diabetes medication, or really any prescription at all. Because as you'll see in a minute, some of these vitamins can interact with common medications in ways that genuinely surprise people. With that said, let's talk about why this even matters. As we age, our bodies change in ways that directly affect nutrition. Our stomachs produce less acid, which makes it harder to absorb certain vitamins. Our skin becomes less efficient at making vitamin D from sunlight. Our appetite often decreases, which means we're simply eating less food and less variety than we did at 40. And on top of all that, many seniors are on multiple medications that interfere with nutrient absorption. Put all of that together, and it's easy to see why nutrient gaps become so common after 60, even in people who feel like they're eating reasonably well. Let's start with the big one. Vitamin D is sometimes called the sunshine vitamin because your skin produces it naturally when exposed to sunlight. The problem is that as we age, our skin becomes significantly less efficient at this conversion process. Combine that with the fact that many older adults spend more time indoors, wear more sunscreen, or live in northern climates with limited winter sun, and you get a population where vitamin D deficiency is extremely common. Why does this matter so much? Vitamin D isn't just a bone vitamin, although that's its most famous job. It's actually the gatekeeper that allows your body to absorb calcium from your intestines in the first place. Without enough vitamin D, you could be eating all the calcium-rich food in the world, and your body still wouldn't be able to use much of it. That's a huge deal for bone density and fracture risk as we age. But vitamin D does more than that. It also plays a role in muscle strength, immune function, and there's ongoing research into its connection to mood and cognitive health. Signs you might be low include fatigue, bone pain, muscle weakness, and in more severe cases, an increased risk of falls, which is particularly dangerous for older adults. So how much do you actually need? According to the National Institutes of Health, adults age 51 to 70 should aim for 600 IU per day, and once you pass 70, that goes up to 800 IU per day. Here's the important caveat though. You don't want to go overboard. Most guidance says not to exceed 4,000 IU per day from food and supplements combined, unless your doctor is specifically monitoring your blood levels, because too much vitamin D can actually push your calcium levels dangerously high, leading to problems like kidney stones. Food sources include fatty fish like salmon, mackerel, and sardines, egg yolks, and fortified products like milk, plant milks, and cereals. But realistically, for a lot of older adults, food and limited sun exposure alone aren't quite enough, which is exactly why this is one of the most commonly recommended supplements for seniors, but always worth confirming with a simple blood test rather than guessing. 2. Calcium. Your bones are always listening. And I mentioned it briefly already because calcium and vitamin D are basically a package deal. One doesn't work well without the other. Here's the thing about bone health that people don't always realize. Your bones are living tissue. They're constantly being broken down and rebuilt throughout your entire life. When you're young, the rebuilding process outpaces the breakdown. But somewhere around your 30s, that balance starts to shift. And by the time you hit your 60s and 70s, bone loss can start to outpace bone formation. especially in postmenopausal women, whose declining estrogen levels accelerate the process significantly. This matters because bone loss, or osteoporosis, is one of the leading causes of fractures in older adults. And a hip fracture in your 70s or 80s isn't just painful, it can be genuinely life-altering in terms of independence and mobility. The recommended amounts are: women over 50 should aim for about 1,200 milligrams per day. Men need 1,000 milligrams between ages 51 and 70, and then that increases to 1,200 milligrams after age 70. But, and this is important, you don't want to exceed 2,000 milligrams a day from food plus supplements, because excessive calcium intake has been associated with kidney stones and, in some research, cardiovascular concerns. The best approach for most people is to get as much calcium as possible from food first. Good sources include low-fat or fat-free dairy products, canned fish with the soft bones still in, like sardines or canned salmon, dark leafy greens like kale and collard greens, and calcium-fortified foods like certain cereals and orange juices. If your diet is genuinely low in these foods, that's the conversation to have with your doctor about whether a supplement makes sense. 3. Vitamin B12. The deficiency that mimics aging itself. This next one is probably the sneakiest vitamin deficiency on this entire list, and it's one I really want you to pay attention to. As we age, our stomach lining naturally thins and stomach acid production decreases. That might not sound like a big deal, but stomach acid is actually required to release vitamin B12 from the protein in food so your body can absorb it. So even if you're eating plenty of B12-rich foods, meat, fish, eggs, dairy, your body may not be able to extract and absorb it the way it used to. And the numbers here are honestly striking. Depending on the study, anywhere from roughly 3% to over 40% of older adults may have insufficient B12 levels. That's an enormous range, but even the low end represents millions of people. Here's why this matters so much. B12 deficiency symptoms overlap almost perfectly with what people assume are normal signs of aging: fatigue, memory problems, confusion, tingling or numbness in the hands and feet. Balance issues. In more severe cases, it can even cause symptoms that look remarkably similar to dementia. But unlike dementia, a B12 deficiency is often completely reversible once it's identified and treated. That's an incredibly important distinction, because I've heard from families who watched a loved one decline for months, only to discover the actual cause was a fixable nutrient deficiency all along. The recommended intake is 2.4 micrograms per day for adults. Now here's something interesting. Unlike a lot of vitamins on this list, there's no established toxic upper limit for B12, meaning your doctor may recommend a dose well above the standard recommendation if a blood test shows you're deficient without the same safety concerns you'd have with, say, vitamin D or calcium. Food sources include fish, meat, poultry, eggs, milk, clams, beef liver, and fortified cereals. If you follow a vegan or largely plant-based diet, this is one to be especially mindful of, since B12 occurs naturally almost exclusively in animal products. 4. Vitamin B6, the memory and mood nutrient nobody talks about. Vitamin B6 tends to fly under the radar compared to some of the other B vitamins, but it plays a genuinely important role in forming red blood cells and keeping your nervous system functioning properly. There's also some genuinely interesting research connecting B6 to cognitive health. Some studies have found associations between healthy B6 blood levels in older adults and better memory performance. Now, I want to be careful here. That doesn't mean B6 is a treatment for dementia, and research hasn't shown that supplementing with B6 improves cognitive function in people who already have dementia. But it's part of a broader picture where B vitamins support healthy brain aging. The recommended amount is 1.3 milligrams per day up until around age 70, after which men need 1.7 milligrams and women need 1.5 milligrams daily. Here's the good news. B6 is actually pretty widely available in common foods, so outright deficiency is less common than with something like B12. You'll find good amounts in chicken, bananas, spinach, chickpeas, fatty fish, and fortified breakfast cereals. Still, some seniors, particularly those with limited diets or certain absorption issues, do end up deficient, so it's worth keeping on your radar even though it's not usually the first thing doctors check. 5. Magnesium. The mineral behind your heartbeat and your sleep. Magnesium is one of those minerals that quietly supports an enormous number of processes in your body, and it rarely gets the attention it deserves. It's involved in muscle contraction and relaxation, nerve signaling, and keeping your blood sugar levels stable. It also plays a role in maintaining a normal, steady heartbeat. And low magnesium levels have been associated with irregular heart rhythms in some research, along with poor sleep quality, which is obviously something a lot of older adults already struggle with. Recommended intake is around 420 milligrams per day for men and 320 milligrams per day for women. The encouraging part is that magnesium is fairly easy to get from a normal, varied diet. You'll find meaningful amounts in nuts and seeds, particularly pumpkin seeds, whole grains, beans, leafy green vegetables like spinach, and dairy products like milk and yogurt. One practical note: certain medications commonly used by older adults, including some diuretics and acid reflux medications, can affect magnesium absorption or increase how much you lose through urine. So if you're on those kinds of medications long term, it's worth asking your doctor whether your magnesium levels should be checked periodically. 6. Potassium. The blood pressure guardian. Potassium is essential for your heart, your kidneys, and your nervous system, and it works almost in opposition to sodium. While sodium tends to raise blood pressure, adequate potassium intake helps counterbalance that effect and support healthy blood pressure levels. A potassium deficiency has also been linked to kidney stones. Recommended amounts are roughly 3,400 milligrams per day for men and 2,600 milligrams per day for women. And one of the best strategies for hitting that number is simply eating more fresh fruits and vegetables, which are naturally low in sodium and high in potassium at the same time. Bananas get all the credit, but potatoes, leafy greens, oranges, and beans are also excellent sources. Now here's an important caution, and this is one that genuinely surprises people. If you're taking blood pressure medications, particularly certain diuretics or ACE inhibitors, or if you have any kidney issues, you need to talk to your doctor before increasing your potassium intake significantly or taking a potassium supplement. Some of these medications already raise potassium levels, and combining that with high supplemental intake can push levels too high, which affects heart rhythm. This is a genuine case where more isn't automatically better. It needs to be personalized. Folate or vitamin B9. Get it from food, not from a bottle. This one comes with a twist that I think is genuinely useful to understand. Most seniors actually get sufficient folate from a normal diet, since it's found naturally in leafy greens, beans, nuts, and other whole foods. The concern isn't natural dietary folate, it's synthetic folic acid, which is the form used in supplements and added to fortified foods like enriched bread and cereal. Research has suggested that consistently high intake of synthetic folic acid, beyond what your body needs, may be associated with an increased risk of certain health issues, including some research pointing toward colon cancer risk and the potential to mask an underlying B12 deficiency, which can allow nerve damage from that B12 deficiency to progress without being caught. Folate plays an important role in cell growth and has also been studied for its potential protective role against stroke. The practical takeaway here is refreshingly simple. For most seniors, the goal isn't to seek out folate supplements or megadose folic acid. It's simply to eat a diet with regular leafy greens, beans, and nuts, and let food do the work naturally. 8. Vitamin K. The one that quietly interacts with your medication. Vitamin K plays two major roles in the body. It's essential for proper blood clotting, and it also contributes to bone health by helping regulate calcium within bone tissue. Here's why this one deserves special attention if you're over 60. Vitamin K has a very well-documented interaction with warfarin, one of the most commonly prescribed blood-thinning medications for older adults. Vitamin K essentially works against how warfarin functions, meaning a sudden increase in vitamin K intake. Say, if you suddenly start eating a lot more leafy greens or start taking a supplement containing vitamin K, can reduce how effectively your blood thinner is working, which affects your risk of dangerous blood clots. This doesn't mean people on blood thinners need to avoid vitamin K-rich foods altogether. In fact, doctors generally recommend keeping your vitamin K intake fairly consistent from week to week, rather than eliminating it, since dramatic swings in either direction are what actually causes problems for warfare and dosing. This is really the central lesson with vitamin K. It's one of the clearest examples of why it's so important to tell your doctor and pharmacist about every single supplement you're taking or considering, not just the ones that seem obviously significant. 9. Vitamin E. Less is more, here. This last one might genuinely surprise you because it goes against what a lot of supplement marketing implies. Vitamin E deficiency is actually quite rare among healthy adults, even those whose diets fall a bit short of the recommended amount. The bigger concern after 60 isn't getting too little vitamin E, it's the risk of getting too much through supplementation. High-dose vitamin E supplements have been associated with an increased risk of bleeding, which is a particular concern for anyone taking blood thinners or preparing for surgery. Some research has also found a connection between high-dose vitamin E supplementation and an increased risk of prostate cancer in men, which is a significant enough finding that many health organizations now specifically advise against routine vitamin E supplementation for healthy adults. The recommended amount is just 15 milligrams per day, and that's genuinely easy to get from food. Wheat germ, nuts and seeds like almonds, avocados, and oils like canola, olive, and sunflower oil all provide meaningful amounts. For the vast majority of people, food alone comfortably covers your vitamin E needs, and a separate supplement simply isn't necessary, and may actually carry more risk than benefit. The big caveat: what most vitamin videos won't tell you. Now here's the part I promised you at the beginning, and I think it's honestly the most important section of this entire video. After going through all 9 of these nutrients, you might be tempted to think the answer is to just take a comprehensive senior multivitamin and cover all your bases at once. But here's what the research actually says. The U.S. Preventive Services Task Force has reviewed the evidence and specifically recommends against taking a daily multivitamin for the purpose of preventing cancer or cardiovascular disease in otherwise healthy adults. And major medical institutions have echoed this, noting that there simply isn't solid evidence that multivitamins protect against heart disease, cognitive decline, or help people live longer. That doesn't mean supplements are useless. For people with confirmed deficiencies, targeted supplementation makes a real, measurable difference, as we've covered throughout this video. But the strategy of just take a multivitamin to be safe isn't actually supported by the evidence. And in some cases, unnecessary supplementation can introduce real risks, like the ones we covered with vitamin E, vitamin K, potassium, and calcium. So what should you actually do with all this information? Here's the simple 3-step approach I'd suggest. First, focus on food first. A varied diet with vegetables, fruits, lean proteins, whole grains, and healthy fats will cover most of these nutrients for most people, most of the time. Second, get blood work done. Rather than guessing which of these 9 nutrients you might be low in, ask your doctor for a simple panel that checks vitamin D, B12, and any others relevant to your health history and medications. Third, supplement with purpose, not with fear. If your blood work shows you're genuinely low in something, that's when a targeted, doctor-approved supplement makes sense, not a broad, unfocused multivitamin taken just in case. So to recap the 9 nutrients worth knowing about after 60, vitamin D, calcium, vitamin B12, vitamin B6, magnesium, potassium, folate, vitamin K, and vitamin E. Each one plays a distinct role, from bone strength to nerve function to heart rhythm, and each one comes with its own recommended amount and its own set of things to watch out for, especially if you're on medication. But if there's one single thing I want you to walk away with, it's this. The real first step isn't standing in a supplement aisle trying to decide which bottle to buy. It's a conversation with your doctor and a simple blood work panel that tells you specifically what your body actually needs, not what a generic label says everyone over 60 needs. If this video helped you, or if it's something you think your parents or an older loved one should see, go ahead and share it with them. This is exactly the kind of information that's easy to miss until something goes wrong. And if you want more no-nonsense, source-backed health content like this, Make sure you're subscribed. Drop a comment and let me know. Which of these 9 surprised you the most? Thanks for watching, and I'll see you in the next one.